Today, for our Safe Kids segment, we are talking about safe sleep for babies. We've got Denise with Austin Public Health joining us now with more. Denise, how are you?
I'm good. How are you? Thanks for having me.
Yeah, thanks for coming on. So this is a topic that I know a little bit about because I had a son at the beginning of the pandemic, and of course we put him in the little sleep sack and nothing else in the crib. Talk about some of that stuff that we need to know.
Yeah, and earlier this month you had Dr. Geleitsmann who talked about the importance of not putting blankets in the crib and using a sleep sack instead, and why that's a suffocation risk. And I wanted to talk a little more about what suffocation risk means. So like you said, there shouldn't be anything in the crib. That's why we say alone in the crib, because they could roll into, let's say, blankets or bumper pads or pillows, and they're still so small and their airways are also not fully developed that it makes it much easier for them to suffocate in a situation like that.
Yeah, and I guess this is interesting because it used to not be this way. My parents didn't understand why we had to do this for our son. It's just, it kind of changes over time. It's something that a lot of grandparents may not realize that they need to be doing when they're looking after their grandchildren.
Yeah, and one of the things that did change was the recommendation in the 90s to put babies on their backs to sleep at all times. And that, like you said, it used to be something different on the side for a period of time and I think on their stomach. But now, since the 90s, we've said always on their back. And just doing that one thing has reduced the risk of suffocation by 50%. So we know parents just deciding to always put their baby on the back when they put them down to sleep is going to be one of the safest things they can do.
Yeah. And before we go, there's sort of an acronym, ABCs. Talk about that and anything else that parents and grandparents need to know before we go.
Correct. Yeah, ABC. So A stands for alone. So again, like I said, nothing in the crib, not even bumper pads. And B stands for on the back. So we want baby to always be sleeping on their back. And then lastly, C stands for crib or a bassinet or pack and play, something that's safety approved for baby to be sleeping in.
Yeah, that's good information. Anything else people need to know before we go?
Just that we would prefer for families to, we understand, especially when the baby's really young, and you probably experience this yourself, that they wake a lot at night, and ideally the baby would be sleeping in the same room as the parents in their crib or pack and play or bassinet. It just makes it easier for families to take care of that baby in the middle of the night, but then put them right back in that sleep-approved space instead of bringing them into bed with them and leaving them in that bed.
Right. Good information, safety tips. Thank you so much. Denise from Austin Public Health.
Thank you. Have a good day.
You too.